Okay, I think we'll go ahead and get started. Welcome to Grand Rounds. I'm Dr. Shannon Marquez, the Academic Dean of the Drexel School of Public Health. It's a pleasure to have you join us here today for our speaker, Dr. Maya Rockeymoore. We have some upcoming Grand Rounds lectures on February 7th. Just want to remind you that we'll have Dr. Nadav Davadovich talking about women's access to antenatal care in unrecognized villages in Israel at the interface of physical and structural barriers. On March 7th, we're pleased to be hosting Dr. Terai Trent. Her focus will be on the hidden contents of the African Pandora box, the case of evaluation of HIV/AIDS prevention interventions in sub-Saharan Africa, and its impact on women and girls. Dr. Trent is also an instructor for our Global Health Certificate program, so it'll be an exciting time for many of the students who have been interacting with her online to meet her in person. On April 4th, we're pleased to be hosting Dr. Don Schwartz, the Health Commissioner, who will give a talk here for Grand Rounds as well. This happens to coincide with Public Health Week. So we have a number of exciting speakers coming for Grand Rounds, and we look forward to you participating. Dr. Rockeymoore has no commercial relationships to disclose. This session is part of our continuing education program as well. So the following planning committee members also have no commercial relationships, including Dr. Michael Udell, Dr. Shannon Marquez, Jonathan Cass, and Kaylee Moran, now that I've gotten the business out of the way. So I'm so excited to introduce Dr. Maya Rockeymoore. We have a number of students who've come today, and so I think I'll take the time to really read her bio, because I think it's a great testament to how we all get into public health. We had a chance to catch up earlier today, and we both sat and thought about how we made it to public health. So think about her bio as you're preparing and thinking about your career in this program. She's an American policy scholar, a noted speaker, an author, a media commentator, best known as an advocate and analyst in the areas of public health, Social Security and Medicare, education, civic engagement, having appeared as a frequent contributor in print, television, and radio, including CNN, Fox News, ABC, National Public Radio, C-SPAN, BET, Huffington Post. Even just 2 days ago, her piece on why I won't listen to Beyonce. I'll let her talk about that in her talk today. But she's certainly always there commentating on public health and community health issues. Prior to her current position as president and CEO of Global Policy Solutions in DC, she served as the vice president for research and programs at the Congressional Black Caucus Foundation, as chief of staff to Congressman Charles Rangel, and as professional staffer as the U.S. House Ways and Means Committee. She is the daughter of an Air Force officer, and we share a lot in common, and we both actually were in families that moved around a lot, and in fact our paths crossed initially. We rode the bus together to school in high school, and then we ended up going to college together, not really because we planned it that way, but we both ended up and landed in the Benjamin Banneker Honors College at Prairie View A&M University, and Maya majored in political science there. At Prairie View, she was mentored, and we were both mentored by Dr. Jewel Prestige, which is the first African-American woman to earn her PhD in political science in the US. And she went on to earn her master's and PhD from Purdue in political science. During her graduate studies, just as you are now, she worked as an assistant to the director of the Marion County Health Department in Indianapolis and taught women's studies and political science courses. Then she went on to serve as the Congressional Black Caucus Foundation Fellow, working in the office of Congressman Mel Watt. And from this position, she became a professional staffer and the chief of staff of Charles Rangel, as I mentioned. One of the great things she did at that time was help facilitate the passage of the African Growth and Opportunity Act, the first ever multilateral trade policy between the US and countries in sub-Saharan Africa. And her dissertation focused on African American political responses to HIV/AIDS, a study of the Congressional Black Caucus in the 105th Congress. And from there, her work really began to focus more and more on these issues relating to political events and health. I want to mention that Early on, she authored and contributed to numerous publications to engage young people like yourself in the political process, most famously her book on the Political Action Handbook and How-To Guide for the Hip-Hop Generation, and went on to serve then as on the board of directors for the National Committee to Preserve Social Security and Medicare, and in June of last year was elected to the 3-year term as the board chair and first African American woman to serve in this role. When she left the Congressional Black Caucus Foundation, she founded her own firm, Global Policy Solutions, a social strategy firm based in DC that provides policy analysis, research, program design, and implementation. And in that role, she's been responsible for a portfolio of programs, including the Director of Leadership for Healthy Communities, a program by the Robert Wood Johnson Foundation designed to support local and state government leaders. So she works very closely with boards of health, cities of public health, departments, as well as other organizations such as the Food Trust on issues related to promoting healthy eating, access, and healthy foods. It is indeed an honor to welcome Dr. Rockeymoore today to speak on the zero moment, public health, social insurance, and the intersection of race, class, and gender. Please welcome her.
Thank you, Shannon, for that gracious introduction. I'll tell you what, when we were riding the bus in high school, I never envisioned that we would be here more than some odd years later, speaking at Drexel University, or that we would have a common path to public health. And so it is my pleasure to be here. She's always been a year ahead of me. I looked up to her as my big sister, and literally in college, she was my big sister. She pledged me in a sorority. And it's been remarkable to see her career advance. And so it's my pleasure to be here before you today as her guest, given our long history together and certainly her remarkable contributions to the profession as well. I'd also like to thank Dean Marla Gold for having me here. I appreciate that. The Grand Rounds Committee, led by Michael Udell, I'd like to thank them for sponsoring this event. And I want to thank Kaylee Moran. Kaylee, thank you so much, wherever you went, for all of your help in terms of arranging the logistics of this event for me, including my travel. And so with that, I know that all of you have been attuned to the big event happening in Washington this week, right? The big event that everybody's been commenting on, which is the fact that Beyonce lip-synced at the inaugural. Who knew that she was lip-syncing at the inaugural, right? And so that is the big story to come out of Washington this week, not the inauguration itself, but the fact that Beyonce lip-synced at the inaugural. But the reason why this is important for me is that on the day of the inauguration, I actually released a Huffington Post article entitled Why I Won't Listen to Beyonce. I planned to release it on that day because I knew that it would be a news hook. Since she was going to be the featured singer. But the premise of the article is that you all know that Beyonce recently signed a $50 million deal with Pepsi to promote Pepsi beverages. And of course, it's a great deal for her. It's cross-promoting her image and her music with a product that has had long-standing and certainly has a global platform. However, my argument is that we know differently now than we knew 20 years ago when Michael Jackson did his Pepsi commercial about the role of sugar-sweetened beverages in undermining the health of all Americans, but especially children and especially communities of color. And so I went on to argue that, the research is becoming clearer and clearer about the connections between sugar-sweetened beverages and weight gain, particularly our obesity epidemic, and how the obesity epidemic leads to all of these preventable chronic diseases such as type 2 diabetes, such as heart disease, such as kidney disease. All of these preventable chronic diseases that actually are costing our nation in terms of poor health for individuals, but costing our nation fiscally as well. Because what do we know about our fiscal challenges in the future are being in part driven by these healthcare costs that are connected to preventable chronic diseases. And so I said, while it's great to listen to Beyonce's music, and somehow most people ignored that piece of it, because I am a Beyonce fan. I'll have you know that even when she was with Destiny's Child, I was bopping to Beyonce, and when she became a solo artist, but I couldn't afford to buy her albums in. But when she became a solo artist, I started collecting her music. And so I said that, complimentary. I called her beautiful in my article, complimentary. I even said, I don't want you to boycott Beyonce's music, but I do want you to basically tune out her Pepsi commercials. Because my argument is that we, not only as adults, we need to become more discerning in terms of how advertising actually affects our choices and our environment, but also as adults help our children to be more discerning about how to be educated and savvy consumers of the marketing that they're being bombarded with, not only on television, but on radio, on the internet, in video games. They're getting it from all sources. And unless we become savvy in terms of how we actually help our children navigate, they won't have a chance because they won't have the capacity or the wherewithal to be able to distinguish why they see a commercial promoting a sugar-sweetened beverages and beverage and why they might want to run out and get and drink that beverage, or a commercial showing a great slice of pizza. And then all of a sudden they're in the same pizza, the parlor in their local store, local communities, chowing down, and then of course gaining weight in the process. So with that, this has been part and parcel of a portfolio of work that I've done over the past several years. And before I get to that, I just want to say, since I am an academic institution, why we're here. To expand knowledge of social insurance and its importance for population health and wealth. Certainly, to increase understanding about the public health implications of changing racial and ethnic demographics in the United States. And to also elevate the importance of race, class, and gender in policy development and implementation. These are the objectives that I want to leave you here with today. But since 2006, I have basically been working on an initiative called Leadership for Healthy Communities. It's a $10 million investment of the Robert Wood Johnson Foundation in promoting leaders at the state level, at the local level, in schools and communities across the country. Promoting leaders who are savvy about using their policy platform, whether they be a mayor, a city official, a county official, or state legislator, a school administrator, a principal, using their platform to support and advance policies that advance healthy living, active living, healthy eating, and childhood obesity prevention in communities across the country. The Robert Wood Johnson Foundation does not invest in individual education strategies. So you may recall during the tobacco era, the first this wave of programs that people focused on were, individual tobacco cessation programs. And what they found from their tobacco efforts is that when they began to focus on policies and systems, then you had massive change occur across the country. And so with that, they started with policy on the obesity front. We've known for quite some time. How many of you have seen the CDC maps showing the trajectory of obesity trends across the United States? Right. So you know that for some time that we've been having this challenge with obesity in our country. And we know that while we're starting to hear that childhood obesity rates are actually slowing in some areas, that we still have a problem. And we particularly have a problem in the very communities that are disproportionately represented, the Latino and African American communities, lower income communities. Studies show that if actually we do nothing, the obesity rate in every state in the nation will be at least 44% by the year 2030, exceeding 60% in 13 states. That is amazing. Now, how many of you know that, so for example, in the African American community, among black women, African American women, 80% of African American women are either overweight and obese. And that is a huge number. In Native American communities, the rate of obesity is incredibly high. There are no national statistics, but the studies that have been done actually point to horrific rates, and also rates of type 2 diabetes. And so a lack of action will almost triple the prevalence of type 2 diabetes, resulting in an estimated 7.9 million new cases of type 2 diabetes annually, compared to 1.9 today. Now, I don't know about you, but this is absolutely incredibly alarming. Because what do we know about these diseases? Not only are they preventable, not only do they undermine the quality of life that people have, but they're also very, very expensive. And so, we're facing a huge challenge as a nation. And so if you look at this chart, basically what it shows is the trends in obesity compared to the trends in smoking. As you well know, the black line, or the trends in smoking, have gone down, just as the trends in obesity have actually been on the rise. And so it's an incredibly important challenge that we have as a nation. And then this is the cost implication in terms of projected costs. And these are in billions. So we're seeing that projections for annual obesity-related spending in the United States are projected to increase. And so the issue of actually targeting policy and policymakers is not just an individual issue. It's not just an issue for communities, it's an issue for the nation. And so with that, we are actually facing a perfect storm, because we actually have other trends that are feeding. It's not just about health. There are other trends that are feeding and driving this issue. And so did you read the headlines this year, last year actually, that all the babies born in the United States now, a majority are now children of color? So out of all the babies that are born in this nation, a majority are either African American, Latino, Asian American, or another ethnic group of color. And did you know that by the year 2019, all children under the age of 18, a majority will be children, youth of color. And then by the year 2042, according to the United States Census Bureau, the nation will be majority minority. Now, why am I pointing this out? After all, we're in a post-racial society, right? Why am I pointing this out? Race shouldn't matter. In fact, what's interesting about race and ethnicity is that, and I work in the world of Washington think tanks. I'm a Hill rat too. I make regular visits to Capitol Hill. And there are people who legitimately believe that race is not a variable that is legitimately considered in research or in policy analysis. In fact, they default to income as the only descriptor or variable. And yet, the reality is that if you actually overlook race and ethnicity as a factor and a variable, you miss a lot of phenomena. If you're looking at the housing crisis, if you ignored race and ethnicity, you would have missed, if you were only looking at income, you would have missed the story about how people of color were disproportionately affected by the subprime mortgage targeting, regardless of income level. You would have missed that story entirely because you wouldn't have been able to tell the story because you were ignoring an important variable that was an important part of the story. And gender, I think more people are comfortable with the notion of considering gender as an important variable, and it is an incredibly important variable because we can understand a lot of socioeconomic phenomena by looking at gender differences, especially when we're talking about socioeconomic status in this nation. But I point this out because a lot of people get uncomfortable when you start talking about race. But because we've got this future already here with the babies, and they're growing, and they're not leaving, and we have to come to terms with this as a nation. And why is this important? It's important because we have this long and complicated history with race in our nation, race and ethnicity. And it has resulted in very clear disparities that are a function of historic inequities and inequality, oftentimes rooted in public policy. And we see the effects of it today. You know, we see the disparate impact in terms of, and I'll be talking about this a little bit more in detail, in terms of educational attainment. We see it in terms of health disparities. We see it in terms of neighborhood, community environment well-being. We see it across the board. And we have basically a majority-minority that's rising, and these are the very groups that have been amongst the most vulnerable in our society. And so the question becomes, what does this mean for our society? In the context of globalization, where the labor market itself, jobs are shrinking because we have a global economy now. In the context of technology, where the need for human labor is shrinking because we have improved technological advances. In the context of budgetary constraints, where the nation's resources, for the moment, in the foreseeable future, are constrained because of imprudent policy choices that have been made, I would argue, as well as imprudent behavior on Wall Street and by banks that have actually created a scenario where we have constrained budgetary resources with the challenges that we're facing in terms of increased healthcare costs over time. And so with that, we have a perfect storm. And this perfect storm, in my estimation, is the anatomy of a tipping point. It's a zero moment. Do we become a vibrant, multicultural society, or do we risk becoming a society that is even more unequal? Because what we know is that a poorly educated majority-minority population with low skills, low incomes, poor health, will not lead to the kind of nation that any of us really want to live in, right? We can project forward about what that kind of nation would look like if you have a majority of the population who have been historically disadvantaged rising and not being able to be full contributors, certainly to the economy, not having the well-being in this nation. In fact, we've seen it in other countries, right? I was actually in San Francisco speaking at the American Society on Aging, I believe. And I was talking to the audience about this and was making my points. And a young woman came up to me afterwards and she said, you know, you're talking about this majority-minority society, but I'm afraid that it'll look like apartheid South Africa. And so how do we and what do we do to make sure that the United States of America does not move towards higher levels of inequality? How do we actually create this vibrant, multicultural, economically sustainable society? How do we do it? How do we do it in a way that supports the health and well-being of all populations, and make sure that everyone is included? How do we do it? And you have to start with that vision, because if you start anywhere else, then you're not aspiring to what we can achieve together. And so, you know, what I've noticed is there are a lot of barriers to solving the problems, but one of the barriers is that we focus on issue silos. You know, the public health folks aren't talking to the transportation folks, who aren't talking to the education folks. In fact, there's animosity between the education folks and the public health folks. And so, none of whom are talking, certainly to the income, security, and economic folks. And so, you know, all of these factors are connected. In fact, as you all well know, there is a growing, and I'd say it's now mature, paradigm that is in the public health world, and that's this social determinants of health concept. Absolutely. Because it connects all of these variables together. That's a frame that we should all be embracing. Health in all policies, HIAP is another term that people are using. And absolutely, that we need to look at health through the lens of all policies because they're all relevant and they all connect. We've got to get over the issue silos. And actually, that's the problem on Capitol Hill for policymakers, not just on Capitol Hill, in state houses, because all of them are actually segregated by areas of specialty. And so when you know that the nature of the solution is actually that it crosses issues, then how do you actually bridge the functional separations, the issue separations, in order to get to the nature of the solution? We have inadequate systems. I would argue that our systems, our democratic systems, have not been built to fully and truly be inclusive of all voices and perspectives in our society. And as a result, we have dysfunctional systems with disparate and suboptimal policy outcomes. And so I argue in my forthcoming book, which I'm struggling to get into, but I argue that we actually have to also look at our institutions of democracy and how we retool them to be more inclusive so that we can actually come to policy solutions that are actually, that can actually speak to the needs of the population. And of course, overcoming this culture of poor understanding, so education is a key component of it. I think people hear the question of, we're becoming this majority-minority society, and it goes in one ear and goes out the other. And they think about no implications for how we do business as a nation. They don't think about the implications about, democratic institutions or business or certainly politics itself. And there is a disconnect between politics and policy in that, the whole notion, because as you well know, politics actually drives policy. And when you have disempowered communities who are not engaged and then connected to the policy apparatus, if they are engaged, for example, in the 2012 elections, but then they go home and there's no other engagement on the policy side, then you also have suboptimal policy outcomes because you're not translating that political power into policy power and solutions for the challenges. So I argue that we must develop a comprehensive, holistic approach to closing the racial health and wealth gap. And we need to look at bridging these policy silos, building, protecting, and strengthening systems, educating policy leaders and other stakeholders, and connecting smart politics to policy. And so with that, I have loosely come up with this concept of the asset house. And when I'm talking about asset house, I'm thinking about our nation as a house that we all live in, and we all live in it together. And there are certain systems that are supported and perpetuated by policies that we have to give dedicated and sustained attention to in order to get to that vision of individuals being healthy and well, being educated, having the income and the wealth needed in order to be full participants in our society. But it's systemic, right? And so if you want to think about it graphically, here it is in my crude notion of this thus far. And that is that at the foundation of that house, you have what we call our communal assets. You have social insurance assets. So for example, like our public education system, which isn't listed there, but I consider that a communal asset. Our universal system of public education, while it does need to be dramatically improved, particularly in low-income areas and areas that disproportionately serve communities of color, it is an asset, and we should view it as such. Like social insurance programs, including Social Security, Medicare, like universal health care, which we have not yet achieved, even with the Affordable Care Act, but I put universal health care up there because that is an aspiration. I think the Affordable Care Act is a down payment on universal health care, but that we have to perfect over time. Like unemployment insurance and workers' compensation. These are communal assets, social insurance policies, and safety net policies that are important. And on top of that, we have policies that support individual and group asset accumulation. So a progressive tax structure that actually supports lower earning individuals and provides a progressive structure that advances their cause. Education policies and incentives, strengthening those. Community development programs and incentives, wealth creation programs and incentives, housing policy, health programs, systems and incentives, safety net programs, fair and accessible legal justice systems. And then we have community assets, and I don't want to ignore this part of it, because even when the pillars of the house are built, we can't forget that the insulation in the attic is often the community assets that we take for granted, like our family structures, our kinship networks, our culture, our faith-based institutions, our community nonprofits, finance, health, and education institutions. These are community assets that are also important for ensuring that we have that well society that we can all envision. And then at the top, the roof, the cherry on top, if you will, is that individual asset accumulation, which includes health and well-being, living wage, education, and wealth. And all of this is influenced by policy, politics, media, certainly belief systems. These are all factors that influence that asset house. And I would argue that these are all factors that we have a role in shaping as public health professionals. And so with that, I just want to take a moment to just visit the nature of the disparities that are feeding into these the issues that I'm going to actually take in a few minutes. I'm going to take the time to focus on one particular area of policy to show how it applies, the issues of race, class, and gender apply. But just so you look at the issue of race in terms of median weekly earnings, full-time wage and salary workers by race, ethnicity, and gender. We all know that women earn less, of course, than men. But there are also, of course, disparities by race. And so this particular graph shows you what those disparities are in terms of weekly earnings. And not surprising. But when we talk about wealth, it's even more stark. It's incredibly stark. For approximately every $1 in wealth held by the average white family, the average African American and Latino family has 6 and 7 cents respectively, or 5 and 6 cents respectively. And so that is incredible. That means that most folks, if they're working, all they have is basically that income. They have no other sources of wealth beyond that, or very few. And guess what? These statistics are from 2005 to 2009. And it just so happens that this is the median net worth of households, the percentage change from 2005 to 2009. And you can see that over that time, and that includes the 2007-2008 period when the recession hit, that Hispanics, that Latinos lost 66% of their wealth in a 4-year time frame. African Americans, 53%, Asian Americans, 54% of their wealth. This is from the Pew Research Center. They're using census data. And why is that? Because of the housing crisis. The housing crisis stripped the wealth, and the targeting of those very communities that I mentioned earlier, they actually were disproportionately affected in terms of the stripping of wealth, in terms of increased foreclosures, the lost value of homes in neighborhoods that were disproportionately serving these communities. And so the housing actually has a huge impact on wealth, because most folks accumulate wealth through their home equity. And then, of course, there is a wealth gap by gender as well. I just wanted to point that out, that single men have a huge advantage over single women, and that, or not that huge, but married and cohabitating, of course, families have a huge advantage over single men and women. But if you actually look at the disparities between single men and women and married partners, you actually see that by race, the differences are huge. And this is called the racial wealth gap. You can't even see a line for Hispanic and Black single women. And that is because that they have near zero wealth, and in some cases, negative wealth. All right, and then, of course, sources of income upon retirement by race and ethnicity. You see huge disparities by race in terms of assets. This is just telling the story in a different light. When people retire, what do they have? And that there are disparities in terms of access to pensions as well. But if you look at that last line, SSI is basically a supplemental security income. It's for those who have no assets. And then you see the trend is reversed, that Latinos are actually taking advantage of SSI at higher rates, and African Americans are taking advantage of SSI at higher rates than whites. So with that, we also have to understand life expectancy because we are public health folks. And so the at-birth life expectancy story tells a different story, the same story, with African Americans having the lowest at-birth life expectancy. Ironically, Latinos who have poor health indicators actually have longer life expectancies than even whites. They call it the Hispanic paradox in the literature. But they live longer, sicker. And so that's an important thing to note. So with that, I set you all up for that because I want to have a conversation about something that public health folks never talk about. And that is the issue of social insurance. And I'm going to pull all this together in a second. But how many of you have heard, I consider it our pillars of progress. Of course, you've heard of Social Security, Medicare, and Medicaid, right? But how many of you have thought about this? That prior to 1935, when the Social Security Act was first passed, our nation had no pension system, if you will, for older workers. So if you actually worked all of your life and then you grew too old or too frail to continue working in the labor market, and if you had no family members to help take you in and support you, you were literally on the street begging for alms in a poorhouse. There was no system of support for you because most private employers didn't provide pensions. And most people were literally out on the street if they did not have family members to support them. That used to be America. But in 1935, FDR decided, with all the support of his staff, decided that we were better than that as a nation. And they passed the Social Security Act of 1935, okay? And with that, as the first time ever, we created a social insurance system. Now, what do we mean by social insurance? What's the difference between social insurance and safety net programs? Does anybody know? Yes?
Social insurance is universally available. Safety net only when needed.
So safety net programs are means tested. For the most part, you usually have to have an asset test. If you have resources, if you have sufficient income, then you're not eligible for safety net programs like TANF, like SSI, like what used to be known as food stamps. You don't have access to those because they're means tested. Social insurance, on the other hand, yes. You pay in. Workers pay in. And you get it regardless of your income because you paid in. You know, people don't understand is when they talk about, we should means test Social Security. Well, when's the last time you heard of anybody means testing your home ownership insurance or your car insurance? Social insurance is the same concept that you actually, as a worker, when I started working at 15 and a half, I got my first job at a grocery store. I was so proud to bring home my first check, but I was shocked when I looked at it because it was like all of $50. And I came home and I remember asking my mother, I said, who is FICA and why are they taking my money? And FICA is the Federal Insurance Contribution Act. That is the law that actually authorizes payroll tax deductions. And my mother said, I remember to this day, she said, that is your Social Security and Medicare, honey. And you will be paying on that until you're eligible for it. And so you pay into it as workers. And so you are entitled to it when you're eligible to receive it. So that is the difference between Social Security, social insurance, and safety net programs. And the reason why this is incredibly, incredibly important right now is because these programs are under direct assault. Direct assault. Literally, we are at our zero moment when it comes to these programs. In 1965, I don't know how many of you know, but prior to 1965, there was private insurers basically would not insure older Americans. Does anybody know why? Only 50% of older Americans were actually insured prior to 1965. Does anybody care to guess why? Private insurers actively discriminated against older people. And we know why. Yes. They're going to use it? Absolutely. You live to 65. You're going to have a busted knee. You're going to have, certainly a need for a hip replacement. You're going to have any number of pre-existing conditions by the time you get to an older age. And so prior to 1965, the private insurance market failed because it didn't serve all Americans. And we decided as a nation that we were better than that we could do something about that. And so we created a program called Medicare. And by the way, prior to 1965, private insurers and hospitals also actively discriminated by race. In the South, and in certain areas in the North, you couldn't get care if you were a person of color. In fact, I'll tell you this story. My spouse tells the story of his father, who till the day he died recounted this story. And that was when he was a little boy in South Carolina. His father, who was a preacher, actually was preaching a sermon and actually fell out at the church house. They brought him back to the house, and he was sitting outside on the porch when two doctors arrived. One was an older white doctor with a younger male apprentice. And they went inside and they assessed Elijah's grandfather. Then when they came out, they started talking to themselves, ignoring the fact that the little boy was sitting there. And he overheard the conversation, and it went something like this. Sir, if we don't get that man to a hospital, he'll die. And the older doctor said, don't worry about it. He's just a nigger. And he died that night. And so that was it was accepted. I talked to my parents. They grew up in the Jim Crow South. And, they tell stories like, how they were afraid. My mother's mother told her never to talk bad about the doctors publicly because you never know what could happen to you if they actually found out about it. It's just a crude system. We decided that we were better than that. But we decided that we were better than that in two ways. Not only did we decide that we were going to create a near universal healthcare system for older Americans, we decided that we were also, for those who couldn't afford it, that we were also going to create a program called Medicaid. And Medicaid was going to give lower income populations the ability to access care as well, and older Americans who are poor the ability to get access to long-term care, to additional services like long-term care. And so with that, we have built what I call these pillars of progress that are under attack because of a variety of reasons. We can talk about why. Some people say that we can't afford them. I actually say that we can't afford not to have them. We cannot go backwards. We cannot go backwards. We actually have to advance as a nation. We have to preserve and protect these pillars and actually build and strengthen them. And it's for all of the reasons that I talked about in terms of demographic shifts, in terms of the economic challenges facing our nation. Young people today are not going to grow up with any sort of security. The retirement system is falling down around their heads as we speak. 401ks have not been the salvation. Private pensions have gone by the way of the dinosaur. Defined benefit private pensions, where you could work for an employer for a number of years and then get a guaranteed check until the day you die, is gone in many places. And so when you're talking about health and wealth, health and economic security and older age, those systems, all of the systems except for these systems, are actually going by the way of the dinosaur. So we've got to protect these systems for everything that they're worth. And I just want to focus on Social Security in particular because what have we heard about Social Security? Somebody just throw out what you've heard about Social Security. That is not going to, I know you heard it. It's not going to be there for you. There has been an ongoing effort to promote this idea, particularly among young people, that Social Security is going bankrupt and that it's not going to be there for the next generation of Americans. So the argument goes, in many respects, that we need to do something about cutting those benefits so that we can extend it for future generations. Well, the reality is somewhat different, and I'll get into that. But before I get into that, let's talk about what Social Security is. It's an old age insurance program. It's a life insurance program. It actually provides survivor benefits for workers who actually leave dependents behind. It's a disability program. So if you become disabled in your working career, you can apply for disability insurance. It protects, it's progressive. So it protects against those who have low earnings over a lifetime. It's got a progressive benefit formula that actually provides a greater bump up for lower earners. And it's inflation adjusted for a lifetime. So you might have heard this whole conversation in Washington about the chain CPI, or the chain CPI is a conversation that's being had, but it talks about this cost of living adjustment, that Social Security benefits are actually adjusted for inflation annually. So it protects against risk. That is what Social Security is. It's a social insurance program that protects against risk. And it's one of the very few government programs we have that did what it actually promised to do. Before Social Security was actually enacted, a lot of older adults were actually in poverty. And what you see is that over time, the amount of people age 65 and older who are poor has actually declined, in part as a result of the Social Security program. So what you don't know is that people of color actually use Social Security differently. And as public health folks, we need to understand this, because all of the factors that we talked about and that we talk about in terms of disparities come into play here. If you look at how whites use Social Security, 72% of them use Social Security as a retirement program. Only 12% of them use it as for its survivor benefits, 16% for disability. But when you look at African Americans and others, there's a stark difference. African Americans tend to use only about half, use Social Security for its retirement benefits. Yet look at that number for survivor benefits. Look at that number for disability benefits. Why is that? Yeah, you got it. Say it, yeah. Yeah. We don't survive. So, all of the factors that we talk about in public health in terms of health disparities, in terms of gun violence, in terms of type 2 diabetes, in terms of mortality, all of these factors come into play in terms of how the program operates differently for people of color. And unfortunately, Social Security only collects other still to this day. And so that is their category, not mine, in terms of race. But you see a similar dynamic happening for the other category as well. And so what we know about this is that disability is hugely important, because we also, of course, have more instances, disproportionate instances of disability, and, of course, survivor benefits. So this is an incredibly important statistic to understand, and I will talk more about why that is shortly. But also look at in terms of reliance on Social Security, and you see that the communities that I mentioned earlier have a heavy reliance on the Social Security benefit. And in terms of survivor benefits, look at the number of children, African American and other, who disproportionately rely on Social Security survivor benefits compared to whites. And that reflects people dying and leaving young children behind. And so why is all of this important? We've been told Social Security is going broke. And the reality of the matter is that Social Security, by the year 2037 or so, will experience a 25-cent on every dollar shortfall. A shortfall in financing. Now, that's not going broke. That's a shortfall. If we do nothing, if policymakers do nothing, that's a shortfall. But look at the numbers, look at the trend line above when we come to this issue of race and ethnicity, that we will be experiencing this shortfall just as the nation turns majority-minority. Now, when they get to the nature of the solutions, what are some of the solutions that you all have heard about what we need to do on Social Security and Medicare? Mm-hmm. Have you heard raise the retirement age? Now, given what I've just showed you, yeah, you're shaking your head. Why are you shaking your head? Right. When you're talking about the nature of the solutions, you have to understand that there are race, class, and gender. There are race, class, and gender effects to every solution that they present. And when the retirement age is one that has huge racial implications, particularly for African Americans. And so when you talk about raising the retirement age, 5 minutes, got it. When you talk about raising the retirement age, you have to realize that it does two things. You are saving Social Security money because you are ensuring that more people in certain population groups never make it to access the benefits. So Social Security saves money when people die and they never access their benefits. But you're also ensuring that people are working longer and paying more into the system. And you will hear the argument that, well, people are living longer. You know, we can afford to raise the retirement age because people are living longer, but the actual matter is that only the upper half of the income distribution is living longer. The lower half of the income distribution, life expectancies are stagnating and in some cases reversing. I don't know if any of you all saw that study last year where white women without high school education have experienced a 5-year decline in life expectancy in the richest nation on earth over the last 20 years. Incredible. And so with that, I'm going to race through this and say that there are ways to strengthen and solve Social Security that have to look at the issues of race, class, and gender. In terms of the gender dynamics, when they're talking about things like cut the cost of living adjustment, that has a disproportionate impact on women because women live longer than men. That means that cutting that cost of living adjustment has a cumulative effect that hurts the very long-lived, which tend to be women. And so there are ways that we can actually get to solvency under Social Security that don't involve cutting benefits. And so last year I was pleased to actually co-chair the Commission to Modernize Social Security, which brought together organizations and experts representing communities of color, where we looked at what the actual actuarial deficit under Social Security was and came up with ways to actually increase revenue while also raising enough money to actually boost benefits for the very vulnerable. And so there are ways that you can do it without, quote unquote, cutting entitlements. And I just want to put that out there for you. And I just want to end by saying that, you know, we can achieve a better society, but that means being engaged in understanding how the nature of these policies, we have to understand the impact on people. That means that you have to do the analysis to understand how race, how class, how gender come into play. And then you have to apply that understanding to the nature of the policy solutions. You can't just, you know, repeat like a parrot, you know, we need to raise the retirement age without thinking about the impact, the disparate impact. And so, you know, we can actually, I think, get to a better society, but we have to become more savvy in terms of applying the work we do on the public health side to all of the areas and being very savvy and sophisticated on public policy. I'd just like to say that several years ago, I went to go visit a friend in France, and we took a hike and came across a what they called, you know, the Le Palais Ideal. It's called the Ideal Palace. And it was built incredibly by a postman who had never he didn't have an engineering degree, he wasn't an architect, but one day in his mid-30s, he stumbled upon a rock on his postal route. He picked up the rock, put it in his pocket, and then he just started collecting rocks, started taking a wheelbarrow with him on his rounds. Took those rocks back to his house, and in the back of his house, he started building what eventually became a beautiful castle that you can actually walk in, comprised of rocks. Gorgeous. This castle that he built is actually a national monument, and it was the inspiration for the surrealist movement in the art world. And so, I talk about that story because these systems and programs that we have built, these pillars of progress, these social insurance and safety net systems, they are our pillars of progress. They're our ideal palace, and we need to strengthen and build upon them if we want to reach that equitable and just society that we need to achieve. Thank you.
We have time now for questions. That was just wonderful talk, Dr. Rockeymoore. And I think we have microphones going through the audience.
Thank you for that talk that covered a lot of ground and showed the interdigitation of so many different things. It's not so much a question, but sort of a comment, and as someone who has lived their life more recently, I guess, in Washington and worked for somebody like my old congressman, or at least nearby neighbor Congressman Charlie Rangel, you've pointed out a number of issues that I think go back to one of your central themes of policy. We have an education policy in this country at the level of states where we are continuing to further undereducate people, so they're not going to be able to understand the kind of presentation you just made. We have a Congress that fights over, should we have 10 bullets or 30 bullets or guns that have no business in proper society, but we can't get in Philadelphia, where it was announced yesterday that 1/3 of the Philadelphia population qualifies for food stamps.
Wow.
1/3, 400 and some odd thousand people out of our city would qualify for food stamps. And we can't get a 1-cent an ounce tax on sugary beverages that you started with. Mm-hmm. And that the people in Congress who put the money up for food stamps don't pass a regulation that you can't use them to buy soft drinks, which would be easy enough to deal with that. And then you talk about the asset house, and we have a Congress that won't raise the minimum wage to a living wage. We in public health can do the research, we can point this out, but maybe my question is, how can we influence the people that ultimately make most of the decisions that affect all of those things?
Right. And actually it is through your research. It actually is through the work that you do, which is used, by the way, to populate the fact sheets and the policy briefs that advocates actually try to educate policymakers on. The issue is that you have this ever rotating, first of all, we have a very polarized political environment right now. But in terms of educating policymakers and their staff, it's an ongoing effort. And so I would argue that public health and the research you generate is incredibly important for getting us to this just society that we're talking about. And we do use those research and statistics to actually make the arguments to undergird the policies. But I'm actually arguing that we need to become better at it because I think that the nature of the challenges is so great that we have to become more savvy.
We can educate people all we want, like education, knowledge and attitudes and behavior. Mm-hmm. We can educate, we can influence attitude, but we haven't changed these people's behavior at all.
Got to tell you that, you're talking about Congress.
Right. I'm talking about Congress, I'm talking about state legislatures,
yeah.
I'm talking about governors that aren't signing their people up for Medicaid on free money.
Yeah. Yeah, no,
I mean, we are an anti-public society more and more. Today there was an announcement we have the lowest number of people belonging to labor unions, down to 11%.
I would argue that this is a result of a sustained and ongoing assault on organizing and labor unions. And as you well know, there has also been this whole traditional limitation for advocacy groups on lobbying that has structured the dynamic in terms of the advocates on our side of issues being able to be full-scale and very vocal activists on these issues. But at the same time, I would argue that we are heading so far backwards that the zero moment is absolutely here. And I think that, and I would hate to think that we would have to go to the pre-1935 kind of America for us to realize that what we had was really great. And that just engages and mobilizes people to an extent that they want to recreate the systems that we just got rid of. But I am arguing that within the next 3 months, have you all seen this debt ceiling extension that just happened yesterday? The demand is that we will not extend the full faith and credit of the United States government. We will default on our debt unless you cut Social Security, Medicare, and Medicaid. Now, the tragedy of this is that Social Security doesn't even contribute a penny to the debt or the deficit. You know, it's its own separate program. In fact, the rest of the budget has been borrowing from the Social Security program. So, well, they're obligated to pay it back because those bonds are there and they have to be redeemed. In fact, the Social Security trust funds, which, you know, is just an accounting gimmick, if you will, but, you know, it runs surplus until about the year 2022. So, you know, it's a program that's sustainable through 2037. But there are things that they need to be doing. But it shouldn't be in the context of deficit reduction because it hasn't contributed to deficit. So the question is, why is it being brought into this conversation? Because there's another agenda afoot. And that agenda, I would argue, is one of people who want to see, they say they want to see smaller government. They say that they want to, rein in entitlement spending. But isn't it curious that they want to do all of these things just as our society is shifting in terms of the demographics, right? I think that there are larger questions afoot. Isn't it curious that, you know, these same arguments are made whether Bush is arguing for privatizing Social Security? I think that there's also a desire for Wall Street to get their hands on Social Security dollars. And so just imagine if Bush had been successful in 2005, knowing what we know happened now in 2007 and 2008, what that would have been for the nation. It would have been devastating. But there is that agenda afoot as well. And so we've got to realize that there are forces afoot that seek to make people more income insecure, that don't care if people don't have access to health care. These forces need to be fought against. And that's what this debate and fight is about.
Question here. Or values in the media. Sorry. And I was wondering why, in lieu of the media, you didn't suggest corporate influence and lobbies and the money, which is really the forces you're talking about now.
I put that together from the perspective of the influences that are important to leverage from our perspective, not from their perspective, although I do think that it is a war against corporate influence and the extreme inequality that we're seeing between the 1% and the 99%. So just this last week, the Business Roundtable came up with their proposals for Social Security and Medicare. And not surprisingly, their proposals include raising the retirement age. Not surprisingly, their proposals do not include, and I didn't get to this because I rushed, but how many of you know that Social Security payroll taxes on wages is capped at $110,100 in current year dollars? This is the only person that knows that. Most Americans don't know it because they don't make that much money. But high earners who are making above $110,000 are not paying Social Security payroll taxes on any earnings above $110,000. The 1% basically pay their Social Security obligations in the first second after midnight of a new year. And so one of the solutions that we offer is actually scrapping the cap, lifting the cap on wages, flattening the benefits for those very high earners, so that we can actually, and if you do that, you actually close 75% of Social Security's long-term solvency gap. Okay? The Business Roundtable didn't include that proposal in their proposal. They didn't include that option. Not surprisingly, they're not going to raise taxes on themselves, but they're recommending cutting benefits for all the rest of y'all. Their proposals actually cut benefits for low-income populations, for middle-class Americans. And so they don't care. They don't care if you're economically secure. They don't care if you have health security. They have their own agenda, and their agenda is not your agenda. More questions?
Well, one of the reasons I was so pensive when I walked up here, one, I hated to rush you, but I knew we had questions. Two, as I thought about the zero moment that you just, it was a powerful presentation that you laid out. And in this last slide, when I really think about the major tenet of our school and our responsibility to really hit home this point, I want to charge our students to think about the context of what you've presented to and what role we need to play in advocating for this. I want to also thank you so much for your time in doing this, and we have a small token for you. Thank you so much, Dr. Rockeymoore.
Thank you. Thank you very much.
And I'm going to get you for saying that I'm like so much older than you. I'm 6 weeks older than you.
But I always thought she was older because she was a year.
I'm just, bright. I'm very smart. Thank you for coming. As I mentioned, we have a number of Grand Rounds programs coming up. You'll get more email on that, and we appreciate you supporting this event. Take care.